Hi, this is Kelly Parker. I'm a nurse practitioner. I'm back again to discuss some different women's issues that you may face and hopefully be helpful in this. This session is going to be about getting pregnant. There's a lot of women that are trying to conceive, and you see these teenagers get pregnant in the car, and people get pregnant when they don't want to, under circumstances that seem impossible, or they're on birth control pills. And then there's this group of women who are trying to get pregnant and going, why can't I get pregnant? What's going on? So as I discussed previously, if your body's stressed, you're not going to get pregnant, and it's normal. It's saving you. It's trying to protect you, because being pregnant is a high-risk business. Your body's not going to let you do it if something's going on. The physiology that has to be in place is that your uterus has a thick lining for a baby to live in. Your fallopian tubes, because remember, your egg has to float through the fallopian tubes and make its way towards your uterus, has to be unoccluded. And there are some circumstances where your fallopian tubes can be permanently occluded or blocked because of infection. And that's why one of the things you should always make sure that your provider is doing for women's health is testing you for sexually transmitted diseases, because chlamydia is one of the most common reasons for having tubes that are scarred or occluded, because you had an infection you didn't even know you had. So make sure that I think of sexually transmitted diseases as it's just a human to human thing. If you had strep throat, you'd have a sore throat, you'd go and you'd get antibiotics. There's no shame in that. Nobody cares. If you had herpes on your lip, no big deal. You have cold sores. You get it in your vagina, everybody freaks out. It's the same thing. So all we do is we want to treat that. So make sure that if you're in your reproductive years and you want to try to maintain your fertility and you're sexually active, just make sure that you're always getting STD testing. And I would do it yearly, regardless if with your one partner or not, because, I used to say that with COVID, when patients would say, well, my kids got in a car with a bunch of other kids and I didn't know they were sick. And I always say to them, did your kid have a mask on? Because COVID and sex are the same. You only know where you've been. So condom. I mean, you got to protect yourself. So you need to make sure that you don't have an ongoing infection or an infection that may have done that. And that's part of your keeping healthy, just like you're trying to eat right and exercise and drink enough water, is that you make sure if there's any infection there, because many times you have no symptoms, so you don't know. So another thing that can happen to your fallopian tubes, though, is your fallopian tubes are like eustachian tubes, and those are in your ear. And you know how you get into a plane or you get in a higher altitude and you feel like you can't hear, and then you open your jaw and try to pop it. Sometimes your fallopian tubes they're just stuck together. They're not occluded. They're not permanently blocked. They're just stuck together. And though there's something called a hysterosalpingogram, which isn't the most comfortable thing ever, but you're trying to get pregnant, so you do what you got to do. And she puts dye up into your uterus and makes sure that the dye flows through your fallopian tubes so they're open. So structurally, that has to happen. You have to have an egg. So we only need one ovary to get pregnant, and they have to be ovulating. And as we discussed before, there's reasons that you don't ovulate. There are some physiological conditions that women can have that makes it difficult to ovulate. Sometimes if you have endometriosis, which is endometrium that should be in your uterus, has somehow made its way out of the uterus. And if there's endometrium right on your ovary, it could cause a lot of inflammation and not allow that ovary to actually release an egg. Some people have a condition called polycystic ovarian syndrome, which you just have a thicker membrane around your ovaries. The eggs just find it almost impossible to get out. A lot of women have polycystic ovarian syndrome and don't have polycystic ovaries. That's why we call this syndrome, is that there's other aspects of it that still could interfere with your fertility. And we'll talk about that a little bit later. But you have to have tubes that are unoccluded. You have to have a uterus that's accessible. You have to hopefully have no infection, no inflammation, and you have to ovulate. Those are all the things that a woman needs. But sometimes even when you see you're ovulating, you're not getting pregnant. And as we discussed earlier, progesterone's job is not only to tell you not to bleed, but also to protect your baby, to keep your immune system suppressed so that you don't kill your own baby. Because literally that's what early miscarriage is. For some women, it's what we call luteal phase defects, where their corpus luteum doesn't make enough progesterone to get their body to ignore what's going on down here. So progesterone's job is just trying to get you to not notice it. But if it's too low, and that level is a little different for women, every woman, if it's too low, and as soon as that blood exchange happens with your baby and you through the placenta, if your immune system's just alerted, then your body's going to go, forget this. And it shuts down the vascular system and the placenta dies and you lose your baby. So those are women who might need extra progesterone or some assistance in ovulation. So they make more progesterone when they do ovulate to help maintain a pregnancy. There's also conditions that you have an immune system that is so good at its little cascade of events that it doesn't take much stimulation for it to cause a problem. There's certain conditions that have clotting mechanism disorders. And one of the ones that's common is something called antiphospholipid syndrome, where if women have frequent early miscarriages, we start testing them for this clotting disorder. And you may see in your history that your mom or your dad or maybe the females in the family had early miscarriages, because it's usually a genetic thing. And then that's something that I would alert my provider to and say, hey, I do have a family history of a lot of early miscarriages, or my mother had a blood clot and she's under 50 and didn't have surgery, that your doctor will go, hey, we need to test for that, because those are things that we can circumnavigate, help you not overcoagulate, and help with sometimes just nothing more than a baby aspirin every day. So all that history is really important for your doctor to know, and for you to make sure that you're compliant and also assisting your ability to not overcoagulate. And then you need to have, some people's uterus are shaped differently. Some people have what we call a heart-shaped uterus. The term we use is arcuate, where it has a little like dent. Instead of be like that, I got to look at my hands to see if I'm doing it right. I'm going to get pictures and put you up there. But so that you can see that it's, instead of this kind of a thing, it goes in like this on the inside, literally heart-shaped. So if your baby tries to implant in this little middle section, sometimes it's just not enough, thick enough endometrium and tissue to stay. Some people have a septum that goes clear down toward their cervix, and that too can be not as good of a place to implant. So those things are all that could be evaluated with. Those are all things that could be evaluated with ultrasound or different imaging and things like that. And then, of course, you can't make a baby by yourself. So at some point, once we've gone through your evaluation and we find the things that we could fix, then it's time to look at your sperm donor. So we'll talk more about some of this things that could cause infertility and some metabolic things that you can be encountering. And then the actual act of trying to get pregnant isn't as easy for some as it is for others. There's some things you may be doing as you're trying to conceive that you're actually sabotaging the whole plan. So we'll talk about that later. Have a great day and hope to see you again soon.